So my name's Ciaran Hill. I'm a consultant neurosurgeon here at the National Hospital for Neurology and Neurosurgery. I'm also an honorary associate professor at UCL Cancer Institute. I have quite a broad neurosurgical practice, but the majority of it is focused on cranial neurosurgery, and particularly complex cases of cranial neurosurgery. So I deal with all sorts of structural lesions, tumours, both benign tumours, things like meningiomas, and more aggressive malignant tumours. There are other conditions I treat too as part of my practice. So these are things like pain, like trigeminal neuralgia. And I also treat other abnormalities of the brain, things like arachnoid cysts, other lumps and bumps that people might find. So I was drawn to neuroscience really secondarily to being drawn to medicine. My passion was medicine and to look after people. I think what was and remains the most important thing for me is to be able to help people at those really difficult points in their life. From a surgical perspective, I've always been a practical, hands-on person, so I enjoy the technicality of the surgeries and the planning and making sure that we have these detailed approaches and bringing the information together and combining that with my interests in research and understanding the biology of the brain. So I have a broad range of neurosurgical operations that I perform. So types of craniotomy, that means openings in the skull in order to improve symptoms or treat lumps or bumps or tumours. Within that complexity, I do a particular subspecialty which includes awake craniotomies. So these are operations which are done in patients who are awake in order to preserve function and make the operations as safe as possible. That's sometimes required. I also perform a lot of minimally invasive approaches. So these are smaller openings to improve recovery and increase safety. They might include endoscopic work or using instruments which are smaller, which go through minimally invasive openings. And then at the most extreme end of the spectrum, I also perform completely non-invasive procedures like gamma knife radiosurgery, so focused radiation treatments. So the approach I like to take is a partnership. The patients that I see, they're the ones who have to live with the disease and the consequence of it. So my role really is to share information with them, let them know what all the options are and the relative pros and cons of each of those options. If it's a surgical treatment that's being offered, I make sure they understand everything about what that involves, what the surgery is like, what the risks are, what we're hoping to achieve. And then we can have a discussion and come to the best decision about how they want me to do that operation in terms of minimizing risk or being aggressive in terms of removing all the tumor that's possible. So we can just figure out what's right for that individual patient, because what different people want varies. And there are different ways to get to that. So it's really a partnership. It's not me telling them what has to happen, but me giving the information about what the options are so that they can decide and I can help them decide how best to treat the condition that they have.